It's now 2 minutes moving down past 11. At this time, we bring you a health discussion on COVID-19. We join your host, Sheena Harry.
Thank you, Hazari, for that wonderful introduction. And thank you to all those who are tuned in live here on DBS Radio, also on Kyrie FM and on the Office of the Prime Minister's YouTube and Facebook pages. Of course, we're engaging the public in discussion on COVID-19. And this morning, our guest is the Chief Environmental Health Officer, Tassie Thomas. Good morning, Ms. Thomas.
Good morning, Sheena, and good morning, DBS. Good morning to the listening public.
And you may be wondering, why do we have Ms. Thomas on the air this morning? But the reason for that is because she is responsible for all the port health officers. And the port health officers would be those you would meet at the ports of entry when you come in, and they'd be responsible for screenings and all the processes that determine whether someone is allowed to even come into the country, right, Ms. Thomas?
Yes, that's very true.
All right. Now, Ms. Thomas, I'm going to put you on the spot right away, as I've done with all the guests before. I'm going to ask you the question that everybody wants the answers to. A ferry came in this morning. And, of course, that has caused some hysteria. Now, if I understand it correctly, it was comprised mostly of Dominican nationals. Is that right?
Yes, very true.
Okay, and we cannot turn away Dominican nationals.
No.
All right, so now tell the public what happened. What happened this morning when the ferry came into port?
Okay, as you may have heard, on Tuesday, this week actually, the 17th, when the French announced the closing of all the borders and ferries would be traveling no more. So this sort of caught a lot of travelers by surprise. So you had a lot of persons from Dominica caught up in the French countries of Guadeloupe and Martinique, as well as St. Lucia. So somehow you had to find a way to bring the people back home, because the people are on the other side, they don't belong there. Most of them must have gone to shop for a day or two and want to come back home. So you have to make provision for them. So somehow provisions were made for them, and we will be having not only this ferry this morning, but we'll be having one tonight, we'll be having one tomorrow morning, one tomorrow night, one Sunday morning, one Sunday night. And we've had the information in advance from the port agents. So what we do is arrange a procedure, a clear procedure as to how to process these passengers, how to screen them, in order that they do not, in order that if they are somehow without symptoms and they are carrying something, that they do not spread it to anybody, most of all Dominicans and the people they live with at their homes and so on. So we have put a nice procedure together, and we are first off implementing this procedure on this very first ferry that is coming in this morning. So everything is in place, and you may think, well, we are only dealing with the ferry, but we are not only dealing with the ferry, we are dealing with all vessels coming to the port of entries in Dominica.
Now, if they didn't come on the ferry, there are still ways that they can enter the country since the borders are not closed, right?
Very much so, because I, for one, this morning, actually, by 7 o'clock, I was already screening passengers from a little cargo vessel that come from Guadeloupe down on the port. Usually this little cargo vessel, they have 5 crew, a captain. They come every Friday with their goods and so on. But the people are over there and they want to come in, so they are going to find a way to come in. So we knowing that, liaising with DASPA, liaising with custom, immigration, and so on. When the vessels come, they must get clearance from customs. So hence, that's how we are. We get the information. Also, some of the vessels have their agents in Dominica. The agents will inform us as well. There's no secrecy going on.
Right.
So we put measures. We have additional staff. We put measures in place. And one thing I've found out, Sheena, especially, I mean, you may say, well, I am the chief, I am the other officers, my staff are working and I'm not on the field and so on. But no, being involved directly doing this this sort of work I realize the kind of stress the officers have to go through, especially if they are to do it alone. So we have implemented, we observed that actually since earlier this week, where we introduced a body system where every officer has somebody else, another officer working with them.
Right.
It takes the pressure off, it puts you more at ease, so you are not likely to make the mistakes that you would make if it was you alone working.
All right. So you spoke about the procedures, and I know there are some parts of that you cannot really go into
Yes,
specific
exactly.
details. But let's say I am one of the passengers that coming in later today. What can I expect to happen once I get here?
Once you get here, actually you are interviewed. We have we have a case-based form for every passenger. We interview you. We get all your contact information, and if you are not for further assessment by a doctor or anything, that is if you do not have a high temperature or if you are not exhibiting symptoms like coughing and sneezing and this kind of thing, we regard you as low risk. So what we would do is have a session with you where you are home quarantined and explain the entire procedure of home quarantine to you. We give you information telling you on a card, telling you that if in case you come down with these symptoms within the 14 days that you are home quarantine, you should not you should not leave the home or go to hospital or any health care facility. There's a number there. This is the number you call. And people in home quarantine, they also have their medical staff within the community that have been informed of the persons in the community that they are supposed to deal with. That's why we take all the information on the case-based form. They are given this information. So every day or every other day, they monitor these people to see whether they are coming down with symptoms and what they are supposed to do. With that home quarantine, you are not supposed to leave the home within 14 days. You are supposed to stay at home for that 14 days. And it is no joking business. You can go in the yard and do little thing, go in the kitchen in the yard itself and do whatever you are doing. But you cannot go into the public. You cannot go shopping. You cannot go to the bar. You cannot go to church. You cannot go anywhere. And this is serious. The people we have under home quarantine, they may believe that nobody is looking at them. And that is something we always tell them. Somebody is looking at you. And if we find you anywhere in the public, you are to be, a police will pick you up, and then there are repercussions.
Okay.
So I'm just saying there are repercussions. We won't explain really what the repercussions are, but the home quarantine is a serious thing. Because something I in doing these measures, we as environmental health officers, we are the first point of contact with the travelers coming in. And we have measures at the airports, we have measures at the seaports and so on. And something I must say, everybody by now is aware of the pandemic. You are coming from what we regard as a hotspot. A hotspot is an area where you have a lot of cases and transmission taking place and so on. You have these people coming in. Okay, you travel probably from the United States, and then you know what measures you are finding in different airports as you are coming in and so on. And you come to Dominica and you realize, well, okay, there are health officers doing something in Dominica too. And then somehow you saw something that is wrong or something you figure that they are not doing right. Instead of you calling on the officer and saying, well, I am so-and-so, if you are an official, I am so-and-so, I'm traveling and I know about this. This is what you are doing wrong and I think you should correct it and so on. Instead of doing that, you let it go on, and the first thing in the back of your mind is, oh, I'm the Prime Minister's body, or this minister is my friend, or I know the PS, I know the CMO. I cannot wait to meet them for me to tell them what health people are doing wrong at the airport. You don't do that, because from time you even you have to think and think smart. From the time you take this taxi, you are coming from a hotspot. You have to think of the taxi person, the people together with you on the taxi. I might be contaminated. How am I contaminating the people in the taxi?
Right.
How am I sharing what I have with the people on the taxi? Whereas, if you realize nothing was done for you at the airport, you could have talked to the health officer, and the health officer would have told you, well, okay, this is what to do, this is what to do. Let me do this for you, let me do that for you. No, they pass straight. Some of them pass straight. They call their best buddies and say, I came from the USA and I came to Dominica and nobody asked me a single question. You think that is nice? When you see the health officers at the airport and you didn't even bother to ask them a question or tell them what it is you think that they are doing wrong. Because as I tell you, it's like every day, this whole situation, as the Minister of Health tell you, it is evolving. It's a fluid situation. So every day you will tweak your whatever you are doing and add new measures, do new things. People don't learn new things overnight. You know, you will make little mistakes. You will people call you out on it. Then you'll correct it. People tell us what it is that you're doing wrong. We put things in place until you have everything nice and dandy going on and so on. But I would like to admonish the people of the world, because we have travelers, we have people everywhere coming in every day. We have procedures in place in Little Dominica as well. So you have family in Dominica. You are living in the United States or maybe the UK. You are coming home. The family in Dominica that you are going to, if you have not been tested or showing symptoms in the UK where you are coming from, or the US, call your family and tell them, look, I am coming home tomorrow, but the UK is a hot spot or the US is a hot spot and so on. What do I have to do? Ask them to involve the Ministry of Health. Call the Ministry of Health. So the person in turn calls the Ministry of Health. That is how we get a lot of persons that are kind of coming from the hot zone that we do home quarantine with. We put them under home quarantine because they call their families. Some of them call their families and tell them that they're coming, and then we put things in place. We are looking out for them and we tell them what they have to do, and we home quarantine them and so on. Okay. Yes.
Ms. Thomas, do you know if we've had an issue with compliance? People coming in, have they refused to be screened? Do you know if we've had that issue at all?
No, actually, nobody refuses to be screened, and I think this is commendable. People know the situation. Usually passengers coming in, and to them it's a rush to go for immigration to go and do what they have to do. But they respect what we do. They take their time and they comply. Nobody has refused screening.
All right. Thank you to the Ms. Thomas for joining us. Of course, the lines will be opened very soon, and you'll have an opportunity to pose your questions. The numbers to call: 448-3284, 616-1327. Of course, 1-800-327, and our overseas line 305-432-9744. All right, so Ms. Thomas, let's get back to the quarantine process. You mentioned quarantine, but what advice would you give, especially to family members? You mentioned that they can call and say, yes, my brother, sister is coming home. But how can family members who are already here, they might have to host these individuals? What should they be doing?
Yes, there are different things that they can do. You may have a bedroom in your home that well, okay, I can pull this person from this bedroom with me and then have this person use this bedroom all to themselves to be their quarantine area where they minimize contact with the rest of the family. They can do that. Likewise, they might say, well, okay, let me put the person in a hotel. But before you even think of the hotel situation, you have to give the correct information. And we would prefer that they get the Ministry of Health involved. So we would liaise with the with the family as well as the the hotel and let them know, well, okay, this person is coming from a hotspot and this person is just being quarantined, person, and inform the person of the quarantine situation nicely as we usually do. So they know, well, they are not supposed to go to the bars or to fancy eating thing. Everything has to be brought to their rooms and everything has to be done for them, and they are not supposed to leave, go to the public or anywhere, and that's the situation. So that can be taken care of.
And what about the cleaning process? You know, we know that we specify a lot about how to clean the areas. So,
yes.
you know, if I pick you up on my vehicle to take you home, or you're in my house, what about that?
Okay, if somebody the areas where we really specify the sanitization of the area is mostly where we have persons that are coming from high risk areas. We have people coming from high risk areas, and then you are quarantined in one room and so on. You are supposed to have your hand sanitizer, your alcohol-based sanitizer, whatever thing you have to make sure that you do not spread the germs. We advise you, we give you a whole lecture on how to sanitize, and whatever your cup, your plate, everything that you are using is marked just for you, and it is washed and sanitized. If you do not have bleach, another thing we try to tell people is that there's no better sanitizer really than bleach. You use bleach, it is available, it is cheap, and people are not buying it out from the supermarket. So that is good. Because to tell you the truth, I saw a poor lady in a supermarket, and she's behind me in the line, and she knocked on my shoulder and she tell me she has a bottle of Lysol and the price on that bottle of Lysol, and she tell me that they said to buy the Lysol. Tell me how to use it. You know how to use it? And then I had to give her a whole lecture as to what she can buy instead of the Lysol, because she didn't have that kind of money for the Lysol.
Right.
But everybody said to buy Lysol, and she's buying Lysol. Everybody's looking for Lysol. But you can do just as good a job with alcohol. The 70% alcohol that is being sold from the drugstores and so on, and bleach, household bleach for sanitizing. If it is an area occupied by the public, for example, a taxi, that is why if we have somebody living from a point of entry showing signs and symptoms and so on, when you are transported on this form of transportation, that transport has to be sanitized afterwards. So we there are companies that we work with. They know what the process involves, how they do it, how to go about sanitizing their vehicles. Ambulance services, fire and ambulance, they have been trained. They know how to sanitize their ambulances when they carry persons and so on. I mean, it's nothing new to them. That's something they've been doing, all the time and so on. So sanitizing of the vehicle, the transport medium is very important.
All right, Ms. Thomas, let's take our very first caller for this morning. Good morning, caller.
Peace be unto you, ma'am, and your guests, and to the staff at DBS and all listeners.
Thank you so much.
Very interesting program, and you hit the nail as you begin with the elderly. And my concern is about the elderly, even here in my country. I'm worried of those who cannot get out. How if they be aware that persons could the necessary things that they want, because they are warning the elderly here not to travel out, but they are upset about it. Right now we have our Minister of Elderly Affairs on one of our radio stations asking them not to go, but they are saying that nothing is wrong with them and they are independent and they need to go to do their businesses. And I am concerned about those persons who cannot get out. Concerned about the kids too. But as you say, a lot of them don't know what to buy. So what I feel that they should do is get some more programs and the simple things that they can afford, because I know a lot of them would not be able to buy certain things, and sometimes some of these people price gouge. And if there's simple things that they have in their home that they can use to help sanitize their home and themselves, I feel that the radio station should bring bring a lot more advertisement in these things that they'll be able to help themselves. But my concern is about the elderly and the children, especially those persons who are shut in and maybe living alone and cannot get out to do certain things. I feel there should be some volunteers out to go and check on them and try to assist them whatever they can. Thank you very much.
Okay, you're
Thank you,
welcome.
caller.
Yeah, but the thing about Dominica right now, we have not restricted anybody's movement to say, well, the elderly cannot go to the shop and purchase whatever they need and stuff like that. They can still do. What we advise very much is to avoid a lot, to practice a lot of that distance thing from people that may be having a cough or a sneeze. You never know what they're coming down from, and then we also educate you as to how to sneeze, good manners, how to sneeze in your elbow or in a tissue and so on, so you don't spread your germs everywhere. It's not just for COVID, but that is good manners. That is good respiratory etiquette, would call it. You do those things. Even for the elderly, well, you're an elderly person, you're going out, carry your tissue with you if you have to sneeze or you have to cough. Be mindful of your surrounding, who is sneezing or coughing close to you, and all of these things. Because the thing is, Rosa was so amazing last weekend. Somebody coughs and is like, you see everybody dispersed. Come on.
Very true.
Come on. Yeah, it's amazing. And I'm happy that even the school children, and I heard people talk about it, how amazing it is to watch the school children, how they go about washing their hands, but nothing beats the washing of hands. And you don't need an antibacterial soap to wash hands. I heard people complaining, all the antibacterial soap gone, I can't get an antibacterial soap. You wash your hands with blue soap. You can wash your hand with blue soap, any bath soap. You wash your hands with soap. The important thing is you wash your hands and you wash it clean and thoroughly. You wash your hands. Hand washing for that matter, I think hand washing, practicing good hand hygiene, this is what will take away or keep the germs as well, the germs of the flu, at bay as much as possible from anyone. Hand washing. And if your hands are dirty, and the first thing you should think about is washing your hand, because we try to tell people do not touch your face and so on. The moment you tell people don't touch your face, yourself you are touching your face and you are not even conscious of it. It is so easy to touch your nose or touch your eyes and stuff like that. So the hand washing is very, very important. So we tell you not to touch your face, but then you're not supposed to touch your face. But then if your hands are clean, you just wash your hands and so on. There's no problem in touching your face because your hands are clean. So the key thing here is the washing of the hands, proper hand hygiene.
All right, I believe we have another caller on the line. Good day, caller.
Good morning.
Hi there.
Morning.
Interesting program, but my question is just a suggestion. If you have a family of 6 and 1 out of the 6 is tested positive, and you're asking them to stay at their home, what happened to the other 5 that are not sick? Hello?
Yes, we're there, caller.
Okay, yes.
My suggestion is like, if one individual out of the 6 is sick, I think that person should be quarantined, not at home, but somewhere else by themselves, and do not infect the balance of the family, because if you put them home and the other 5 are not sick, eventually it's going to spread around, and that's why it spread along like that.
Yes, yes.
So that person should be like in the institution where they quarantine people.
Yes, and then that is true. And then we have institution for quarantining persons that are really tested positive. But we for right now, thank God, we don't have any cases. We don't have anybody positive. But then we have in our plans a facility that has been designated for quarantining people that are tested positive with the virus, so they do not infect other people.
Right.
That is, this point is well taken.
Yes. Now, what I would also like to advise the caller, there is a big difference between being self-quarantined and being isolated.
Yes.
Self-quarantine offers... Right.
I understand that, but I'm not looking at isolating it. To me,
But
it's
if you
not
test
isolating,
positive,
it's
then you
kind
would
of
have to be...
protecting the others.
Right, but if you
And
test
also
positive for the...
protecting others.
If you test positive for the coronavirus,
Yeah.
caller, then you cannot be self-quarantined anymore.
No.
If you
You have
test
to be taken
positive,
away to
then
a
you will be taken to that facility.
Yes.
Okay.
Okay,
Yes.
so that's why I'm explaining the difference between self-quarantine. That's for people, even they haven't been tested positive, but for precautionary sake, because they are asymptomatic. But let's say like the people coming on the ferry, we know that Guadeloupe or Martinique, they have cases there. They are asymptomatic and they haven't tested positive, but for precaution's sake, we advise that they have to be self-quarantined. That's
for
different
14 days,
for 14
yeah.
days. But if you go to your blood work is done and you test positive for COVID-19, that's a different story.
You are taken into isolation.
Okay, so thank you, caller.
And for the self-quarantine, you are monitored. You are monitored by the medical staff.
Right.
So you are not on your own. So you shouldn't be afraid to report if you know somebody suffering from something or coming down with flu-like symptoms and you suspect anything. You shouldn't hide it. It's if you hide it, it means that you are prepared to spread it. And you have to think of your family. Think of your family first. It's not just other people going to get it from you, but your family is at risk as well.
All right, we have another caller on the line. Good day, caller.
Yes, good morning. Then, I said we have to be educated on that COVID-19, and sometimes I think the best place to really begin is at the early childhood center. Some people don't realize that, but they are the best messengers to bring home the message. So I was very happy when he said that school should stay closed, open, because I figure out the children being at home is not going to help any situation. If they are at school, at the childhood centers, we can at least monitor what they're doing and educate them. Because that is what we're doing. We're educating them on COVID-19. They are not too small to know the etiquette of what they have to do. Wash their hands. I think wash their hands it's like a song, and we sing it every day. Wash your hands, wash them every day. So they know they have that thing. They have the idea of the coughing and the thing. I mean, I heard it's a very interesting. What I do, I listen to the program because I heard them say that the best way to get through knowing what you're doing is to get the facts from the people itself. So you listen to the Ministry of Education, you listen to the health, you listen to education. So you as a caregiver can at least educate the young. We are doing it at school. I'm very happy that the children are getting aware of those things every day. They're coming home, they're coming back to school, they tell me what they tell their parents about, what they educate their parents about. So that is good. I think that is very good. It's a very interesting program. And I listened during the week, and I could not wait for Friday for the continuation.
Okay.
Thank you so much, caller.
So
Thank you.
much. And as she rightly said, she mentioned the importance of getting the right information. And as she said that, I wanted to clear up something as well, because, with the advent of social media, the bad news spreads like wildfire, but the good news, you almost don't hear it. And it depends on the person giving the news.
Right.
Social media, like, for example, Facebook. If I read a message on Facebook from somebody like Stalaza COVID virus, and I'm going to say, who is Stalaza? And then I forget about that and so on. But if you're a doctor practicing in Dominica and I have to read information on your Facebook page with regard to COVID virus, it goes without saying I am going to absorb it, line, hook, and sinker. Everything. I take it as the truth. Because you're a doctor, you are seeing patient, you know what you are talking about. So people have to be very careful as to the type of information that they put out there, and they have to remember who they are in giving information.
Okay. Very true. All right, another caller on the line. Good day, caller.
Hello, good morning.
Hi,
Good
good morning.
I just calling to tell Miss Summers that her Port Health staff are listening. A very good job. Keep it up.
Thank you. Thank you so
Okay.
much. All right. Okay, so to continue along that line, with regards to this information, I feel like I must clear up this story that went out during the week with regards to this young lady that was feeling ill and that kind of thing, because I think we owe it to the cruise industry. We owe it to even the agent, HHV, Whitchurch as well. You see, if it was, for example, one of my staff boarded that particular vessel, the Grandeur of the Sea, I would have said, well, okay, the information that they gave me, maybe it wasn't correct or they missed something or something was mistaken and so on. But no, I was the one who boarded that vessel. And I can tell you for a fact that there were no cases of coronavirus, not even suspect cases, not even flu-like symptom cases aboard that vessel. That vessel was clean. I regard it as clean because why? They had quite a few elderly persons on board, people in the region of 71, 80 years old. And there was only 8 cases of gastroenteritis on board. That is diarrheal illness on board. And of these 8 cases, 6 had already recovered and 2 were still in recovery. So for somebody to be an important person in society and to come up with information telling people that the ship had 2 cases of or more of influenza on board, COVID-19 on board. I mean, this is sad. People have to investigate. People have to ask questions before you go to the media, to the public, and divulge such kind of dangerous information.
All right, Ms. Summers, we have another caller on the line. Caller, good day.
Hi, good day.
Hi,
Good day, ma'am.
thank you for tuning in.
Thank you. Good day, Ms. Thomas.
Yes, good day.
Let me quickly commend you all for your great effort that you've been putting forth, helping the people of Dominica get ready for what may be an impending health situation.
Let's hope not.
Ms. Thomas, I want to reiterate a great point you made, because with everything that the authorities are doing, it is going to come down to personal responsibility.
Definitely.
Yes.
Every individual must do the right thing, must listen to the advice, and must do the sensible thing. And something I heard on the radio recently really disturbed me, and you talked about it earlier. A well-known radio personality came from a hotspot in the U.S. and is on the radio the next day talking about, well, the government is not ready because nobody checked out the airport, right? Are you ready?
Exactly.
Right? If you know you came from a hotspot, do the right thing and quarantine yourself.
Yes, your
Right?
family.
Because
Yes.
You absolutely, because as we all know, this thing could be in the system for 14 days without showing up.
Yes.
Right? Nobody
exactly.
knows if you are positive. So instead of what wisdom is in it, to go on the radio, what's the benefit of that?
Exactly.
And say
Who
the government is not ready
benefits?
when you are the one
Nobody.
who've been traveling, right? So we have to just do the right thing, the common sense thing, and stop trying to make an issue out of everything.
True.
We have to take responsibility for our action and protect ourselves, and by doing that, we protect other people. Thank you very much.
Exactly. So
You're doing a
thank
fine
you
job.
so very much.
Thank you,
Yes, you're
caller.
welcome.
All right, would you like to emphasize a little more on what he's saying,
Yes, I said that at the beginning, you you're coming from a hot spot, you arrive at the airport, you see somebody doing something, it could be health, it could be immigration, but you see somehow some measure is in place to try to contain this virus. You are coming from a hot spot. Instead of talking to the individuals at the airport and probably educate them on what it is that they are doing wrong or what they are not doing, and find out what is going on so that you in yourself may be asymptomatic, as the caller rightly said. You may have the virus in your system and you're not showing any sign. You're looking good. You figure out, well, you are good. No, you have to self-quarantine yourself, do the right thing, and then within 14 days, no symptoms, no any signs of the disease, and you know, well, okay, I'm not infected. But bypassing the officer, not saying anything, and going on a radio station or probably going to your buddies and telling them that, oh, Dominica is not ready, we are not doing anything. You are not helping anybody.
Right.
You are not helping the country. We have to be our brother's keeper, and we have to realize no matter where we belong, what denomination we belong to, what political parties we belong to, we are all in this together. We are all Dominicans together, because if Dominica goes down, every one of us goes down. The virus does not choose. It doesn't tell you, oh, okay, because you are tall and you have plenty money, you're looking good. You stay back. I'll take this little poor man on the street. No, it does not discriminate. All of us in the same boat. So let us do what we have to do, the responsible thing, and try to protect ourselves and protect our family and protect the country on a whole.
Definitely. And, I just want to, stress on that even further by telling people, even in the most developed countries, with their plans in place, there can be gaps, there can be loopholes. We all know that. We have to all recognize that.
Right.
But we cannot take for granted that there is a system in place here, and if you see something, you say something.
You say something.
Instead of the negative talk, not constructive. There's a difference between being constructive. Criticism is fine if it's constructive, and that lessons can be learned from that.
Yes.
But like I said, even in the most developed countries with the most resources available, there can be gaps.
Yes.
And we said that at the beginning, that this virus, this COVID-19, it's fluid. It changes. As research continues, as research develops, new information is presented. So that means things might have to change. Even when we assess situations, we realize that the symptoms may be changing. We might discover a new symptom, and then we have to add that to the list. So things change. Protocols may have to change because of that.
Thank you.
We ask that you know something, you see something, you say something so that something can be done.
Exactly.
We're asking that. We have lots more calls coming in. Let's go straight to the phone lines. Caller, good day.
Good morning.
Hi.
Good morning to the panelists. I want to commend the healthcare professionals who are putting themselves out there in Dominica's preparation to deal with this COVID-19 virus should it get to our shores. It seems that some people are praying for it not to come here, but they're looking for it to come here. But that is a matter for them.
Okay.
I have heard you all using very nice language and bad news, but I want to add that fake news spreads much quicker than good news.
That is very true.
And in particular, when the fake news is coming from someone, as you said, a healthcare professional. And that is why you probably won't be able to name, but I can name, and I can say that it was very irresponsible for Dr. Sam Christian to go on social media to talk about this case or this Atkinson thing, and to say, like he was in the room testing the patient, that this person has this virus, came from cruise ship, and you would believe somebody like that saying these things. And when an ignorant person, someone who doesn't know better, gets this kind of information from someone who should know better, they will run with that information. And you have to condemn people who are doing that. Look, we are very happy that there's no COVID-19 in Dominica. But I'm rest assured that with the professionals like you all, that if a case were to come to Dominica, we would be prepared to deal with the case. We would be prepared that, look, we would have things in place so that it does not spread to a large section of the population. Because you look at first world countries like Italy and the United States, were they prepared in dealing with this disease? Were they prepared to fight it? Look at what is going on with countries where everyone thinks they have better systems than us, whether it's healthcare, primary, secondary, any system they have is better than this. But look at what it's doing to them. And while we make all these preparations, what we really want is that we never have to come on radio and report that there's a case of COVID-19 in Dominica. And I want to commend you all. You all are putting yourself out there. You all, if this were to come, you all will be the frontline people who have to deal with this. Your families will have to say bye-bye to you for a little time while you stay away to deal and help sick people. And people who come from overseas, when you don't quarantine, it's not somebody you don't know if you live in Sufra. It's not somebody in Cottage that will get it,
I know.
It's your family that is close to you, your
Very
friends.
true.
Because these are the people you will be intermingling with. So it is not like if you come and you support one political party, you'll give it to somebody on the next party. No, it's the people close to you who you deal with who will be most at risk to get it. And I'd just like to encourage you all to keep on doing the good work you are doing.
Thank you.
And let's
Thank you.
hope and pray that as this continues, we continue to report Dominica has no cases of COVID-19. But if one were to come, these are the things we have put in place to stop any spread, to suppress it. Thank you.
Very well said.
Thank you, caller. And let's go directly to the next caller. Okay, we must have lost that caller. And we want to thank all those of you who are tuned in to this COVID-19 health discussion on DBS Radio, Kyrie FM, and of course, the Office of the Prime Minister's pages. Back to the phone lines. Caller, good day.
Hello, good morning.
Hi. Go ahead, caller.
I would like to find out, do you have any place prepared for the south, for the eastern direct area? Because if you have a place in Portsmouth area, what about the south? And if the person come in and they don't have the symptoms, they go home and they self-quarantine. But let us say it is developed in Grand Bay or in Scott's Head. Do we have a place that they can be placed in instead of coming all the way down to the hospital? I'm just asking.
We have one place, and nowhere in Dominica is far, sweetheart. It's like anywhere in Dominica from Roseau, there's no place more than 2 hours drive, 2 hours, 15 minutes from Roseau. No place is far. Wherever you are with the disease, you can be transported to the facility. It doesn't make sense to have facilities all over the place. You have to have medical staff to man these places. It's a burden on your resources already. So if you have one huge facility where you have a limited number of persons or a set number of medical persons taking care of these people, it is better managed, it is better handled to take care of people. That is where people will be transported to. So it doesn't make sense having needle spots all over the country.
Very good. And just to add a little bit to that, like Ms. Thomas emphasized earlier, the thing that we are stressing is self-quarantine, and the health officials in that district, in that area, will follow up with you. They will check on you. So let's just say you start developing symptoms. Then a different protocol will then be enacted. And we have special ambulances assigned for that specific purpose. So it's not like we'll tell you to take a random taxi if you're not feeling well and leave, Bellevue to come down to there are special ambulances assigned just to deal with that. So if the person becomes symptomatic in the Southern Health District, the health district will follow up, will take notes, will assess the situation and advise accordingly if they need to be transported to the isolation area. All right, caller, thank you so much.
Thank you so much.
No problem, caller. Thank you. Thank you so much. All right. Do we have another caller on the line? Not as yet. Let me ask you, Ms. Thomas. You mentioned you are the frontline workers. What about protecting yourselves? We talk about all what we do for everybody else, but you have to protect yourself and your staff, and you also, mental health is also very, very important in situations like this. Tell us about that.
Very much. And let me tell you, what you wanted to miss? Go ahead. In terms of protection for the staff, we have supplies for every staff at their locations, and we emphasize the use of the personal protective equipment that they are provided with. You have to use it, and it's like we have a WhatsApp group, and every day I will stress to the staff, look, you are right at the front of the thing, dealing with passengers coming in and so on. Protect yourself. Make sure you have your mask on. Make sure you have your gloves. Make sure you have your gongs on. Protect yourself. Protect yourself. Protect yourself. And you know, one thing I can tell you that was so very good for the mental health of a lot of the healthcare workers in Dominica. You see that all this number of cases that were tested, and the result came out with that big red zero that has been going all over the place. That is it's like a boost for how you call it, a big boost for the mental health on the whole. It is people feel more calm, more at ease. You see people smiling and so on. They are so confident. They feel so good, you know, because of that. And we know what we are doing. It's a lot of work, and then people tend to think, well, oh, they are not doing nothing. People will just sit down and tell you, well, but they're not doing nothing. And I'm hearing them all the time. They're not doing nothing. There are times when I leave home, if I don't eat a proper breakfast, and I don't like to eat very early. If I don't eat a proper breakfast in the morning, I don't get to eat until probably all 8, 9 o'clock in the night, you know, when I reach home or when I come from a meeting and that kind of thing. It's like you go out and you are there in preparation. Sometimes you have to find yourself on the ground doing the work as well, helping one of your staff and so on. You are all over the place and you never have the time to stop and eat and so on. I mean, it is stressful.
Yes.
And then when you hear people just talking and saying that they are doing nothing, you just have to shake your head. I don't let it get to me. Some people might take it to heart and end up with high blood pressure and whatever else, but I don't let it get to me. You know, once you know what you are doing and you know you are doing it from the goodness of your heart with the best of heart, you just go and do what you are doing and feel good about it.
All right. All right. We have another caller on the line. Caller, good day.
Yeah, I just want to say in regard to that fake news, I think it is time that that may not be on your line of discussion, but I want to put it out there. It is time that the authorities pass legislation to deal with these things, because it's not just coronavirus or anything. Fake news down the road is going to have a nasty effect on our economy, because what it does, it discourages people from coming to our country. It will discourage visitors that we need, especially post-corona, from coming to our country to spend money in our country to boost our economy. It is time, because we take it lightly. Oh, well, somebody just spread a fake news. No, it has repercussions. And when you repeat it and you keep adding, and every month is a different subject on a fake news, it erodes the credibility of your country. It is time that they pass legislation to stop those things. Thank you.
Yeah, well, like you said, caller, that is a little above our pay grade.
Exactly.
But yes, we all have to, when we share things and circulate things, we all have to think of the ripple effect that these things will have. Because fear and panic cripples people.
It cripples people.
You know, so if it on spreading fake news or unnecessary news, that cripples their reaction, you know, and the precaution that they need to take to protect themselves. All right, we have another caller on the line. Caller, good day.
Hello, good morning.
Hi, good morning, caller. Go ahead.
In terms of the nursing homes, will you be all advising, motivating them? What do you all do? Will be doing any work with them, the nursing homes?
We have health promotion. I can tell you, Ministry of Health. There's a list of all the nursing homes in the country, and there's a procedure in place as to how to deal and educate and otherwise manage these nursing homes as far as coronavirus is concerned. I know for sure there is something in place.
Okay, for both residents and workers?
Yes, all institutions, yes.
Okay.
All right, thank you very much, caller, for that. Do we have another caller on the line? Caller, good day. All right. We do not have another caller on the line. Just to reiterate what the numbers are, 1-800-327-616-1327. Of course, the 448-3284. And for our overseas callers, 305-432-9744. 305-432-9744. All right, so Ms. Thomas, we were talking about the care of your employees, their mental health, and we were also stressing how important it is. They need the encouragement.
They need the
so
yes.
family members, loved ones, they need your encouragement.
Yes, especially from their colleagues.
Mm-hmm.
They need the encouragement because if you have to come to work and knowing that it's a stressful job and so on, and then you come to work and then you are at loggerheads with the boss or the supervisor, that doesn't do good for your mental health, especially at a time like now. All of us need to pull together like a little family and discuss our problems, how we can address them, how we can improve on certain things, and don't have this kind of negativity or bad vibes going on among colleagues and that kind of thing. I am quite happy that every staff member in my department, we are on board, we are together with each other, and we are doing very well. It really, really helps the people in the front line in being at ease and being calm in doing what they are doing, and at the same time protecting themselves. Because sometimes when you're under stress, if things are not going well, you forget to put on the thing that is supposed to, the protective equipment that is supposed to be protecting you, because your mind is elsewhere. It's not into what you are doing. But if everybody is on board with you and so on, you feel good, your family is okay, you reach at work and then well, okay, before I arrive at work, my supervisor called me and reminded me of this, reminded me of that, everything is going well. It sort of makes your day. You're looking forward to the job, that kind of thing. So it doesn't augur well on us in the different departments to be at loggerheads with each other, having this bad spirit going on among us and so on. That is a time we need to pull together and give each other the support that we deserve.
All right, definitely. Let's get back to the phone lines. Caller, good day.
Good day.
Hi, good day. Go ahead, caller.
How are you?
Doing well, thank you. And yourself?
I'm all right. I'm calling from Portsmouth. I have a concern about the yachts at Turkey Beach. There are a lot of persons coming out from the yachts and they are intermingling with the locals all on the beach. What have you all put in place to deal with that situation?
Very good question, caller.
Yes. You see, we have measures in place to handle these vessels as well, with regards to the health of the passengers on board. You may see them and you may feel, well, nothing is being done, or they're always there and stuff like that. It's the same thing with the cruise ship coming in. I heard so many stories when the cruise ships are coming in. But the cruise ships, when you see a cruise ship dock in your port, most times it is even the safest place to be than in certain areas and stuff like that. The cruise ship is very, very clean. If you see a cruise ship dock on your port, it means that the cruise ship is very, very clean. Because with the cruise ship, they have agents on land that make the arrangements with us, where we get the health documents on time. We can examine it. We can ask questions. We can request certain information, certain documents, and everything. We do everything we have to do to ascertain that everything on board these vessels are fine. The yachts can be pretty hard to handle, but we still have measures in place for them, where we monitor the health of the passengers on board, because they are in our country and it's like they are part of us.
Right.
So it doesn't make sense that they are there and you just forget about them, you're not dealing with them. We monitor them as well.
All right. If I remember clearly, there's a flag system with the yachts before you even board the yachts to inspect or do anything. They're supposed to have some...
Not the yachts.
Not
the
the
yachts
yachts?
don't carry
Okay.
them. The other boats carry them.
They
Like
carry the
cargo
flags.
boats,
Okay.
the cargo boats and the cruise ship, they carry this yellow flag.
Right.
Yes.
Okay.
Once you see the yellow flag is flying, it means that they have not been given clearance.
Okay.
Because anytime the ship is given clearance to do business with the country, you take down the yellow flag.
The yellow flag.
So anytime you see the yellow flag flying, it means that I need clearance.
Okay.
I have not been cleared. Yes.
Okay, and just to stress, we did the health promotion unit. We did a session with the yacht boys in Portsmouth not too long ago. So like you said, there are things in place. Things are being done to not only deal with the yachters, but the yacht boys who in many cases are the first ones who even interact
Yes.
with the yachters. So
yes, that is true. Actually, the word is yachties.
Yachties.
Yeah. We are mindful of that as well, and then we have put measures in place for these people through their associations. They have associations as well, because that was a very risky thing where they are the people, they call them water taxis. They are the people who first make contact with the yacht and even transport people from the yacht to the shore and stuff like that before the vessel is cleared and anything like that. So measures have been put in place with them. They know what they have to do right now and how they have to stay away.
Definitely.
If the vessel has not been cleared. So we have something in place for them.
All right, back to the phone lines. Caller, good day.
Hello.
Hi.
Yes, caller, we can't hear you very clearly.
I'm just calling.
I'm sorry, caller, not to cut you off, but we can't hear you very clearly. We're going to ask you to try again first, please, because we can hardly hear you. All right, just try us again. And I believe we have another caller on the line. Okay, so we were talking about the yacht boys, and what we want to emphasize is even if you don't see it, doesn't mean something isn't happening.
Exactly.
Right.
Exactly.
A lot is happening behind the scenes.
And that is a perception that people have, and I just find they are using it too much. I need to know everything. You don't need to know everything. That is why government pay people to look after you. Something is happening. You don't have to know everything, but it is happening. People are taking care of you. And Dominica, I have to tell you, we have your best interests at heart, and we are taking care of you.
Definitely. Another caller on the line. Caller, good day.
Good day.
Hi, good day, caller. Thanks for tuning in.
I'm calling from New York.
Yes, ma'am.
I am so happy about the program that is going on in Dominica, and I know you all are on point. And I don't care what people say, I know Dominica is taking good care of its people. I am in America, and they have so much bleach there. They are making so much mistakes.
Go ahead, caller. Hello?
Hello?
Yes.
Go ahead.
I am in America, and I listening to your program in Dominica, which is very, very interested. You all are on point. Everything is just good. We have people just trying to spread fake news, and I'm not one of them that listen to fake news. Because we have a small country in Dominica, but I know all you have everything in perspective. I'm in America, and we have everything there. And people more scared here than they should be. And we have everything. So you all are doing a great job in Dominica, and may God bless you all and protect you all. That's all what I want to say.
Thank you so much for that. That means a lot to the healthcare officials, I can tell you that.
Thank you so much.
Yes, thank you so much, caller, for that. Ms. Thomas, we're getting close to the end of today's program, and there's never enough time because there's always so much to say. But let me engage you in your closing remarks. What else would you like to emphasize for the general public?
Okay, I want to emphasize the hand hygiene etiquette that we keep educating the public about, and we are trying to educate just about everybody. All different groups are calling us, and then what we have done, we have given COVID-19 priority. We have designated a team to educate the different groups and so on. I don't want to feel like I'm advertising because we are already overwhelmed, and I know the health promotion in themselves are already overwhelmed, but the education that we are providing for you, please go by that. Practice good hand hygiene. We are doing it in the schools as well, because we know once you tell it to the children, they take it as gospel and they take it home and they educate the family as well. Proper hand hygiene, proper respiratory hygiene when you are coughing, when you are sneezing. If you are leaving your home, never leave without a handkerchief or a tissue for you to cough in. Not because you may have a flu, because from time to time we clear our throats. And I'm telling you, even sitting at meetings these days, people are afraid to cough. They're afraid to clear their throat because somebody next to them might pull their chair and think, well, they're spreading something. I'm telling you, a lot of people are panicking with regards to that. And what we don't want is the fear and panic. We want people to know, well, okay, I know about proper hand hygiene. I wash my hands. I even carry my soap with me wherever I go so that I don't only use the water, but I use soap to wash my hands. Carry your soap with you. It's not a problem. And as we say, it's not just antibacterial soap. You can use any soap for washing your hand. It's not only hand sanitizer. You might not have hand sanitizer. My God, get rubbing alcohol. It has 70% alcohol in it. It's good. If you can't get rubbing alcohol, bleach is another thing that you can use for sanitizing. You don't necessarily have to use expensive Lysol for sanitizing surfaces and so on. Bleach does just as good a job. And if you are at home, if you have a food establishment and you need to sanitize, you use either bleach or you use boiled water, hot steam for sanitizing. So all in all, not because we are concerned about COVID and we are giving coronavirus our almost 100% of our time right now, for the people employing the risky area we are calling the food industry to think, well, they should let their guards down and do what they feel like. We have persons that will be looking on you, and we need you to help us as well. Be mindful of sanitation, proper sanitation, and cleanliness in your food establishment. Educate your staff as well with regards to proper respiratory hygiene and also hand hygiene as well. Do these things in your place, and if everybody does that with keeping Dominica safe in mind, we won't have COVID-19 on our shows.
All right. Thank you so much, Ms. Thomas, for your time. We want to thank all those who have been tuned in for the past hour or so. And we want to thank all our media partners for coming on board, because you are one of the key resources in spreading the factual, current and correct information. So thank you to our media partners. Of course, we urge our public to get the information from the credible sources. Listen to environmental health. Listen to the Ministry of Health. Listen to even you can check out WHO's website, PAHO's website, credible sources. And also, like Ms. Thomas said, practice the proper hygiene. Protect yourself, protect your family. We invite you to tune in again on Monday, same time, for another edition of this COVID-19 health discussion. Thank you again for joining us here on DBS Radio, Kyrie FM, and the Office of the Prime Minister. Thank you all.
Across the Caribbean, you listen. Across the world, you listen. And at home in the nature isle, you listen. You listen to DBS for unbiased coverage of breaking news.